Hey, welcome back to Dog Hobby 2020. Here I am with another video for you to munch on. Please participate in the polls that appear on top right of your screen. If you are here for social message, please watch last 3.5 minutes of video. Before we go to topic, let us make it clear that medicine should be consumed only after doctor's prescription. So topic for today is acute mastitis and breast abscess. Here we have a case scenario. A 26-year-old female with her 6-week-old baby has come to OPD. She complains that she has pain and redness in right breast. Patient denied any nipple discharge or lump in the breast, but she complains that her right breast is larger than the left one. She complains of little pain in the nipple during breastfeeding. Doctor took the consent for examination and asked sister to accompany patient to the examination room. On examination, right breast is larger than the left one. It is erythematous. Nipple appears normal. On palpation, right breast is tender, warm, with palpable fluctuant edematous swelling in inner lower quadrant, and there is no discharge from the nipple while manipulating swelling. Axillary lymphadenopathy is noted on the right side. On doing ultrasound, it is an ill-defined mass measuring 4 cm in its greatest dimension, with central hypoechoic area with internal septation, debris, posterior enhancement, eccentric thick walls with increased Doppler in walls and surrounding tissues with lack of internal color Doppler. Since it is less than 5 cm, doctor performed fine needle aspiration and sent it for culture and sensitivity. He told sister to explain patient how to breastfeed, how to express breast milk manually, and how to use breast pumps. Doctor prescribed dicloxacillin antibiotic and ibuprofen for pain relief. If allergic to penicillin, clarithromycin can be given. If community-acquired methicillin-resistant Staphylococcus aureus is suspected, clindamycin is given. Hot compression can be done for pain relief. Continue breastfeeding. Clean the nipple gently after each feed. If difficulty to breastfeed on affected side persists, express breast milk manually or by using breast pumps. Chance of recurrence should be told, which requires incision and drainage. Assure the patient that swelling is not cancer. Follow up after 14 days. How do you manage if the same case scenario comes to your OPD? Social message to mother. Why should you start breastfeeding as soon as possible? Because milk can be easily expressed in initial few minutes. Baby is alert initially and still has got time for his deep sleep, so use this time to give most of the energy and immunity through your milk. This is the time when you have many health professionals around you and they can help you to initiate feeding, clear your doubts and solve any problem if you have with breastfeeding. You will feel confident about breastfeeding. How do you position the baby? The position described here is one of the common positions preferred, but always follow the position that is demonstrated by your doctor because they choose that position specially for you based on multiple factors. Cradle the baby next to breast and slightly keep baby's head extended, supporting on your arm. Baby's stomach should touch yours. Hold your breast with thumb above the darker circle around the nipple and other fingers below the breast, like how you hold a doorknob. Push the nipple along with areola into baby's mouth. Don't force baby into the nipple and areola. It's the opposite that is effective. What if you don't position your baby properly? Baby's temperature will fall because the close skin-to-skin contact that is achieved in breastfeeding position will maintain your baby's body temperature. If not properly positioned, your nipple may get injured and you will be the next patient visiting the doctor with pain in the breast. How to know if you are successful in breastfeeding? Baby will suck, then swallow. So this rhythm can be heard by you. Initially, you will feel your uterus contracting during breastfeeding. Feed 8 to 12 times in the first 5 days. Later on, baby will tell you when to feed. Don't follow clock, follow baby's cry. Don't take stress, be relaxed. Don't be under impression that you don't have enough milk for the baby. Mark my words, you have more than enough. Understand this, babies drink more often, not more amount. Switch to other breast only if milk is over in one. At least put on one breast for 15 minutes. How do you know if your milk is enough for your baby? In first 14 days, babies lose weight. but not more than 10% if properly breastfed. From 14th day, baby will gain weight at least 20 grams per day till 42nd day. First 2 days, he may pass urine only 2 times a day, but later on, 6 to 8 times a day if properly breastfed. By 5th day, he will pass yellow stools, till then green-black. Many times initially, but at least 3 times at 4 to 6 weeks. Later on, the frequency decreases. Take a nap when baby is taking nap and stay awake when baby is awake. Then you won't feel tired. Talk to other mothers, friends, family members, only those who will encourage you. Don't hesitate to consult your doctor if you have any problem. Know that your problem is theirs. Social message to father and family. Support her in this process. Please comment on my video. Share to the relevant people, especially if they are pregnant or if they are practicing or supposed to practice breastfeeding. Like the video and subscribe for notifications on future video. Thank you.